Hi, good evening. This is Alicia Young, a founding managing partner of Finn Partners, a privileged colleague of Jodi Brooks, who inspires me and everyone we work with every day. I'm here with Jodi and Dr. Ramakrishna, and we're going to spend the next 15 minutes or so talking a little bit about Jodi's experience, the research that's going on at NewYork-Presbyterian Weill Cornell Medical Center, and what we can do as Jodi's community to continue to help her along this journey and be supportive the way that she's always been so supportive of us. Now, Jodi, we've done a lot of presentations together, you and I at Finn Partners. This one's going to be a little different, but we're going to have a good time. So without further ado, for those of you who do not know Jodi Brooks, let me tell you a little bit about who she is. She's a managing partner with our agency. She's been a communications professional for 20 years. She's a mother. She's a seasoned communications person. She's a relentless go-getter. She's a wife. She's a daughter. She's a fighter. And she's one of the bravest people I know. And she is supported by her own warrior, Dr. Rohan Ramakrishna, who's our hero in helping Jodi and ensuring that Jodi is going to stay with us for a very, very long time. For the last 6 months, Jodi has been battling stage 3 brain cancer, something she didn't ask for, something she didn't do to deserve, and no one battling cancer ever does. So Jodi, I hope we can start this conversation tonight by going backwards a little bit. Can you take us back to June 13th and tell us in your own words a little bit of what you remember and how your health is today?
Yes. Hi, everybody. And thank you, Alicia, for the introduction. And thank you for starting with tough things to make me start in tears, which was not the plan. So, you know, when this happened, I wrote my story out online. And while anybody who knows me, I'm very outgoing and gregarious, but not when it's pity or anything that puts me in a position that I can't fix. And that's been the hardest part of this, Dr. Ramakrishna, which I know you are well aware of it. So it was in the middle of COVID, in the very quite beginning. We live in Cobble Hill, Brooklyn, and I was taking a walk on the phone with my sister. And I told her I was feeling dizzy, and I've been dizzy for a long time. I just thought that's what I am. I get dizzy. And her words didn't make sense. And I guess I had a massive brain seizure. I was in the hospital in Brooklyn Methodist, part of New-York-Presbyterian. And when I came to, I saw the white lab coat and the red inscription where it said New-York-Presbyterian. And I was like, good, thank goodness, because I didn't know where I was. And fast forward, I came home, and we just thought I had a seizure, and it wasn't, which Dr. Ramakrishna will explain it much better than I can. And but fast forward, I've had a craniotomy, and I've had a radiation for 6 weeks, and chemo, and now I'm on a 12-month intense chemo program, 5 days on, 23 days off, monitored closely. And it hit my speech and my processing. It's much better than it was. And it's been tough. It's been tough because of COVID, mainly COVID, because I'm tough, and I could give me any medicine, give it to me, I can take it. It's the not knowing, and which is analogous to COVID that I know many of us feel. So how's that, Alicia?
That's great, Jodi. Thank you so much. It's not easy to share, and we're so thankful that you are for everybody who's battling cancer. It's so wonderful to have you here to tell your story. Dr. Ramakrishna, Jodi told me she felt in very good hands, knowing that she was coming to in the world of New-York-Presbyterian Weill Cornell. It's an institution near and dear to her family. Her son was born there, her mother was born there, and then you came into her life as her hero. Can you tell us a little bit about your own journey, how you became a neurosurgeon? And specifically, can you maybe talk a little bit about the Rhodes Center and that group that you are working with, and a group that is being supported by the donations here tonight?
Sure. Well, so first of all, thank you so much for having me and for this event and for this organization. I mean, it's truly a remarkable thing, and all of you deserve, kudos, at the very bare minimum for all of this and all you're doing for patients. So thank you. As far as your question about why or how I became a neurosurgeon, the brain is so wonderfully and is so wonderfully complex, and the ability to operate in the brain and make people better was something I found truly fascinating when I was a medical student, and still do. There's so much unknown about the brain in terms of how it works, both in health and disease. And I'm privileged to work at a place like Weill Cornell Medicine and NewYork-Presbyterian, where we've got such amazing healthcare providers, from the doctors to the nurses to everybody who works here. It's really a privilege to work with a group of people who are so dedicated to making people feel better, and to advancing the science, so that the patients of tomorrow can get even better therapies. So I feel inspired every day when I'm here, which is a nice feeling. As far as the Rhodes Center, this was a relatively new organization within New York Presbyterian Hospital, where it's designed primarily for the treatment of gliomas, like the one Jodi had or has, and the main purpose of it is to fundamentally transform the therapies that we offer patients with brain cancer. And our mechanism is to fund innovative research projects across Weill Cornell Medicine and Columbia University. And the way we do that is we fund promising research, what we hope will be path-breaking research that'll help, again, advance the science for our patients. And so that partly revolves around giving money for research projects to people who are already doing glioma research and are hopefully doing innovative things, but also funding research projects from people who are really talented, have incredible methods that they've developed, incredible expertise, but it might be in a different area of cancer. And so we want them to apply their innovations towards the glioma field, again, in an effort to work collaboratively and hopefully discover new therapies for our patients. So it's been going on for about 2 years now. We gave our first round of research grants this past year, and it's been really, really successful. The one example I'll give is we had a marvelous, talented young researcher named Dan Landau, who's done amazing work in genetic sequencing, but much of his work before was in hematologic malignancies. And as someone who participates and reads a lot of these research papers when they come out, I thought we need to get him involved in our field. And so these kinds of projects allow for that, give researchers like him the space to collaborate with us and use their science in our field, and hopefully make things better for everyone.
That's wonderful. Thank you so much. And it's wonderful to know that we can be here to support the continuation of that type of research and advancement on a particular kind of cancer that is so complicated and so challenging. Jodi, to go back to you for a minute and to talk a little bit about your brain tumor. For someone who's making a living as a communications professional, your tumor also did affect your speech and your processing, and that's something you've had to work very hard to build back. Can you tell us a little bit about what you do and how that work is going?
Sure. I think I wish my husband was with me, sitting here, because he was with me the whole time when I don't really remember a lot in the very beginning. It was hard to talk in the first few weeks. I couldn't hear 3 conversations at the same time. I couldn't get syllables. I couldn't he's and she's, and they're still kind of tricky. But very quickly, Dr. I couldn't say your name last either. It took me a lot of practice, but I'm working with a wonderful neurological psychologist, and she is focusing on my cognitive, and I do exercise. I read out loud every single day because that's really hard to do. I practice before I do things. I say words in categories so they become more easier to retrieve, and the syllables. And I feel everyone says you sound the same. I know it's getting there. It's not the same. But it's getting better and better. And Dr. Ramakrishna, I think you share with me about the brain and how elastic it is. And I find it remarkable. You know, we've
Yeah,
talked
I
about.
mean, I think the other thing that you didn't mention, you know, your surgery was, you know, not so routine. It was what we call an awake craniotomy. So she was awake for much of the actual operation. And the reason for that was to map the language cortex of her brain so that we can know with high fidelity that when we remove the tumor, we don't permanently hurt speech areas. And the brain will, you know, for lack of a better word, rewire a bit in the healing process and allow for the kind of speech recovery that Jodi has mentioned. But the awake craniotomy is sort of a, you know, a key ingredient in being able to do that.
There's not much that gets Jodi to slow down, let me tell you. So
Mm-hmm.
she's got the energy of 10 people. Jodi, tell us why you wanted to come forward with your story now.
Well, first is really for Peter Finn. You know, he's a kind and generous man, and to make coming to work easy and working with me to get better. And that's all he said. And so did you, and so did Dan and Howard and Mark, and on and on and on. And I realized that through COVID, as people are losing their lives and their jobs and around you, that's not as common as we all should be. And so that was the impetus why I came out. The second one was Jeff, and when I saw that video, I said I have to, and I didn't want to. And the third is that I think I can help, and I think it's the right time. It's the right moment. We all need to be better, and we all can be better. And whether it's in dollars or it's time, you know, COVID didn't allow us to help our family much, my family, and I think people are looking to help.
Yeah.
And whatever I can do, you know, I still think I'm going to be here for a while.
Oh, well, yeah, absolutely. Dr. Ramakrishna is her neurosurgeon, and the community of people around Jodi, whether it's her colleagues or friends or family, what can we do for Jodi or for anyone facing a cancer battle to be our most supportive of people going through that journey? What sort of advice do you have for those that are also here to be inspiring and help people be as strong as they possibly can?
You know, there's I don't know if any of you listen to the Freakonomics podcast, but I love it. And at the end of it, Steve Dubner says, you know, if you can, take care of yourself and hopefully someone else too. And I think you know, I find that very inspiring that he says at the end of his every podcast. And you know, I think everyone's always going through something, and you just, you know, as family members, as friends, we have to be patient, and in particular when we take care of patients with cancer, you know, be their advocate, you know, and sometimes people won't or can't or feel shy to advocate for themselves, but whatever it is, you know, advocating for your friends and family in this situation is really important.
Do you happen to remember one of the conversations you had with Jodi? It might have been late June, early July. You said something that really was a comfort to her. And I know Jodi remembers what it was. You said something that she was waiting to hear. And it was that you were going to be friends for a very long time. Do you remember that?
Oh, yeah. I mean, I think, you know, my job as a doctor who treats patients with cancer is to, you know, be realistic, but also be hopeful and use every bit of skill and talent, hopefully, that our team has in taking care of patients like Jodi to give them the best possible outcome. And so for me, that means in practical terms, you know, that I'm going to know Jodi for a long time. That's my goal as one of her doctors.
I guess we have a shared goal because Finn Partners isn't letting go of her either very quickly. Jodi, do you have anything else you want to add to your incredibly courageous and brave and inspiring story?
Thank you. I just want to say it's really hard to not have a lot of control of things. You get direction. Oh, you won't get diabetes if you exercise and eat well and that kind of stuff. And that was the hardest thing that I don't really have much control. And I'm figuring out. When I had radiation, I couldn't move. I was still for 6 minutes, 7 minutes every day. And I was scared. And then I looked forward to it because it calmed me down. And it was just a symbol that to be uncomfortable is okay. And, this is our time and we're all going chaos. And I think, I don't know. I just, I have a good doctor, so he's going to take care of me. Thank you.
Oh, thank you, Jodi. Listen, thank you both for joining. Dr. Ramakrishna, thank you. We know you're very, very busy and doing really wonderful work that's going to help a lot of great people, especially our Jodi. And Jodi, thank you for your courage and your bravery, for sharing and for fighting and for keeping it going. We really do appreciate that. I think what we're going to do next is take some questions and answers or questions from the audience, if there's any for Jodi or Dr. Ramakrishna.
Hey everyone, I'm back. I just want to say thank you so much to all of you. Jodi, incredible story. And, I remember you and I were just speaking about it a couple of weeks ago, and my heart goes out to you, and you're just so inspiring and so brave and so strong. And it really just is, I remember when we met a couple of years ago and, we got along really quick, really fast. And it's just, you're an inspiration. So, and to take the time to just, go live on Facebook and talk about it. I mean, that's so brave too, that's
Stop saying it.
And Dr. Ramakrishna, I mean, my gosh, just listening to you talk was just inspiring and educational and just so powerful. And to just hear about everything that you're doing and everything that occurred here was just incredible. And Alicia, seriously, thank you so much for moderating this. And we actually do have a question that I can raise. It's from Renee Martin, who of course none of us know who that is. And she's asking, Dr. Ramakrishna, with all of the research into medical therapies, should a greater amount of research be done on emotional, psychological support therapies?
Well, sure, absolutely. I mean, there's the medical part of taking care of someone with cancer, but then there's the dealing with it part. And that part, when I see Jodi or any of her doctors see Jodi, we see her for a very constrained moment in time for 30 minutes, 40 minutes, whatever it is. But then the rest of the day, she's by herself and with her family and loved ones. And how she or anyone else in this situation deals with, this diagnosis, with, taking care of yourself in the middle of all of this, taking care of your family. Jodi's a mom, as you know, is stressful. And that undersells it in terms of how stressful or anxiety inducing I'm sure it can be. So in terms of what things work best to help manage that, absolutely more research along those lines would be appropriate, as well as, for caregivers. It's not, as you know, the patients are one aspect of it, but the caregivers are also under enormous stress. So how best to help them through these processes, I think, is really important.
Thank you. That's fantastic. And we got another question. This one's for Jodi. So Jodi, Mary Beth Navulis wants to know, are there any lessons or words of wisdom we can tell other PR and communications pros who might be going through similar health challenges?
Work for Peter Finn. I mean, I say that in light, but making sure you're working some with people who care about you, you know, and who give you the room, you know, be good at your job, but also have that. And also, PR is really, really important. And I think we can translate this, things like this happen to things that matter, you know, and working closely on diversity programs and women's right programs for corporations. And it feels very natural and much different than it used to be. You know, it means more to me than getting a product placement. So you evolve and it helps.
Thank you. And thank you so much. This is an emotional night, everyone. Again, I want to thank you so much, Dr. Ramakrishna, for taking the time, Jodi, for just being so brave and sharing this story with everybody, and Alicia, just expert moderation and discussion.
Have the
all
easy
around
job here.
everyone.
Nice job, guys.
So
Guys.
claps to everybody. Thank you. And for everyone else here, a quick reminder, the silent auction is going on. We are accepting donations right now. Please, oh wait, we have one more question, everyone. I'm gonna pop in real quick from Dan Pooley for Dr. Ramakrishna. Are there warning signs or clues that people should know that might help us better identify this type of cancer? How are we doing in the medical community in earlier diagnosis?
So it's a great question. You know, these are pretty rare tumors. So I don't want anyone to leave this thinking that if they have a headache, that they have a brain tumor. You know, that's very rare. And the typical symptoms of a brain tumor at diagnosis are seizures or persistent headaches that you're not used. Like if you have a history of migraines, you probably just have migraines, not any other, you know, nefarious thing going on. But if you have headaches that are, you know, persistent and unusual for you, you know, a neurologic deficit like weakness, numbness, something like that going on, you know, imbalance, you know, problems with walking, and seizures, as I mentioned, those would be obviously unusual things that you should talk to your doctor about and potentially get a scan. As far as early diagnosis, you know, the problem with gliomas is I can scan you today and it'd look fine, but then I could scan you 3 months from now and you might, you know, theoretically have a tumor there. They can grow that quickly. So it's not something where we can screen necessarily effectively for, but there is a lot of research going on to try and figure out how we can potentially predict those patients who might develop a glioma or predisposed to one, and then figuring out strategies about how we could potentially do early detection. There is a foundation in New York called the Brain Tumor Foundation, whose main goal is to figure out how to detect these tumors early. So again, some effort being put to that effort.